Logan, and today we'll be showing you how to transfer a patient from a supine to prone position and a prone to supine position with a dependent patient, a patient who needs minimal assistance, and an independent patient. When you first walk in the room, you first want to check the patient's chart for weight bearing status or their post-op procedure orders from the doctor. You also want to check their weight to get an idea for how much they'll weigh if you need assistance. You also want to check for IV lines, cardiac leads, or catheters. Before you perform the procedure, you want to explain to the patient how the transfer will be performed, and you want to make sure you obtain consent from the patient. While you're performing the transfer, make sure that you maintain proper body mechanics at all times.
You also want to make sure all the dead wheels are locked.
I'm Katie. I'll be your physical therapist today. How are you?
Good.
What's your name?
Emily Freeman,
And your date of birth?
May 31st, 1991.
Okay, can I check your wristband? This is Logan. He's going to be helping me today.
Hi.
We're going to be turning you from your back onto your stomach, if that's okay. Okay. So the first thing you want to do when you're transferring the patient is you want to make sure they're close to one side of the bed. So as you can see, Logan's going to move her in segments. He'll go from the upper extremities to the pelvis area and then lower extremities. So she's close to one side. So if Emily is moving to her left side, we want to make sure the right leg is crossed over the left. And there are two different positions you can put the arms in. The first is shoulder flexed, elbow straight, arm next to the ear. And the second is elbow extended, palm up, and close to the pelvis. So when you go to turn them, you want to make sure that you're standing right close to the bed and make sure you maintain proper body mechanics. So I'm going to turn you around to your side now. Is that okay?
Yep.
Good. And as you can see, she's a little close to the edge, so I'm going to have Logan pull her over to the side.
1, 2, 3.
Good. And now there's enough room for her to go flat onto her stomach. After the patient is prone, you can move them over to make sure that they're in the center of the bed.
1, 2, 3.
Emily, are you comfortable?
Yep.
All right, good.
I'll show you how to move a dependent patient from prone to supine. So when you do this, you want to place the extended elbow and the palm face up underneath their pelvis. And you want to take, if they're rolling towards their left side, you take their right leg and place it over top their left leg. So now she's ready to be flipped, to be transferred over to supine. So I'll just grab her and provide a little bit of resistance on the posterior shoulder. And then obviously she needs a little bit more room, so I'm going to provide some contact like with my thigh so she doesn't flip off. And Katie's going to move her over to the end. And we'll reposition her so she's more comfortable.
So now we're going to show assisted supine to prone and prone to supine. So Emily, can you roll over onto your stomach for me?
I think so.
Okay. So as you can see, her leg is crossed over onto the side that she's rolling onto. Her elbow is extended, palm up and close to the body, and then she'll roll towards me. As you can see, she might get a little stuck, so you can help her with this part. Roll over onto her side. There's enough room on the table, so if you fully want to come over, and good. She was able to use her arm to kind of push her down. Now she's in the prone position. Okay, now that we're finished with that procedure, I'm going to have you roll back over onto your back.
Okay.
So what I need you to do is cross your right leg over your left. Good. And push up off the table with your right arm to sideline. Good. And then if you can, roll yourself backwards slowly. Good. Good job.